Linda Rice, Vice President for Grant Making at the Hampton Roads Community Foundation. I'm here in Norfolk, Virginia today with Dr. Gregory Fritz, a psychiatrist and past president of the American Academy of Child and Adolescent Psychiatry. He's a national expert who recently retired from Brown University, where he was the director of the Division of Child and Adolescent Psychiatry. Dr. Fritz, who is from Providence, Rhode Island, just finished giving an Understanding Hampton Roads talk to over 300 Virginians interested in children's mental health. Today's breakfast forum, sponsored by the Community Foundation, is in partnership with the Children's Hospital of the King's Daughters. Dr. Fritz, thank you so much for joining us. And would you tell us why children's mental health is an important topic in southeastern Virginia?
Well, children's mental health is important in Southeast Virginia the same way it is important everywhere else in the United States and probably the world. Children's mental health is a source of terrible problems for children. It's the most expensive of all chronic pediatric conditions. It results in suicide attempts and suicide deaths, such that for many age groups, suicide is the second leading cause of death. It keeps children from developing to their full potential and to being as happy and as carefree as we wish they would always be. It's all pervasive, it's incredibly common, and there isn't a family that is not affected by mental health issues. And if some family says they don't have any psychiatric problems in their family, I don't believe them. So it's everywhere.
Does psychiatric mental health currently carry the same high priority as other health care for children?
Due to stigma, psychiatric disorders don't get equal treatment and equal payment and equal priority as other aspects of medicine, more traditional medical or surgical problems. And fortunately, I think that's changing, that the stigma is being addressed and is reducing compared to what it was, but it still is a terrible problem that leads to people being hesitant to come forward to get their children the help that they need if they have a psychiatric disorder. It leads to professionals choosing not to go into the mental health disciplines in medicine and psychiatry. There is a terrible workforce shortage, and some of that has to do with the stigma. Those who take care of stigmatized patients are themselves stigmatized. And insurance companies don't treat mental illness still with the same degree of parity or equality that they do for chronic medical problems.
Are there warning signs that parents and teachers and medical professions should be aware of as they're working with children?
So the people that know children well, their parents, their teachers, the doctors that take care of them, should be aware of potential warning signs that it might indicate that the child is struggling and in need of help. Some of those warning signs that are changes from the way the child normally acts, so withdrawal and not talking and being hard to reach for a child who is usually gregarious and outgoing, being a child who has unexplained pains and aches, but who normally is pretty healthy and carefree. Changes in what they like to do and not wanting to be as active or not being as invested as they usually are. Changes in their ability to concentrate or focus on their studies the way they had been able to prior to this.
What typically happens to children whose mental health or mental illness goes undiagnosed or untested?
What typically happens as they're struggling to develop with this untreated and undiagnosed psychiatric problem is that they don't reach the goals and attain the abilities and at one level of development that form the foundation for the next level. So then it's like if you don't learn to multiply and divide, you can't do calculus. that sort of thing. So the subsequent development always is impaired to one way or another from this untreated psychiatric thing, and frequently it can persist into adulthood. It can lead to addictions or conduct problems, that sort of thing, and it generally gets worse.
So with that in mind, what would you say would be the best step, one single best step that a parent, grandparent, or teacher could take to ensure a child's mental well-being?
Well, for a child to grow up with a solid mental health foundation, the best thing that we can do is provide them with a loving and knowledgeable and caring family and parents. And if the parents are struggling, we provide help for them for their depression or their whatever issues the parents have. Treating the parents and getting them back on track inevitably and demonstrably helps children with their issues. There's a threshold beneath which parenting isn't good enough, and it damages kids. And I mean, I'm talking about abuse and neglect and that sort of thing.
Thank you very much, and thank you for giving us some hope for the future. We have a medical system here that is working on children's mental health, and you gave us so many insights and so much statistics to help us as we plot our way forward to help our children be stronger.
Well, your whole community is behind it, and they're making an impressive commitment to this, and an unusually impressive commitment. And I think you're to be commended on that, and I think the future is bright.